Great. Good morning. I'm Cynthia Schendel, and I serve as co-chair of the Social Work Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I asked the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Andrea Perdomo Morales,
Present.
Donna Honer Quayle, Annis Boyer,
Present.
Jasmine Cohen Young, Mary Gill,
Present.
Mike Gillette,
Here.
Leanne Gingery, Yolando Johnson,
Present.
Christy Sanders,
Present.
Eric Schonecker, Robin Unruh, and Callie Worth. I note the following BSRB staff members are also present: David Fye, our Executive Director,
Here.
and Leslie Allen, our Associate Executive Director. Next, David Fye will read a message concerning this meeting being held remotely.
All right. Thank you, Cynthia. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the advisory committee to discuss anything relevant for public comment, although the advisory committee is not required under the Kansas Open Meetings Act to provide public comment. Any individuals wishing to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the COMA are not suspended. Therefore, we will be conducting this meeting pursuant to the COMA. On August 20th, 2025, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meetings. This notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And before we started the meeting, we did check the conference call line. There is one individual who is attending the meeting through the conference call line. So I'll go ahead and allow that person to go ahead and state their name for the record. That way we have down there sitting in on this meeting as well. So if any individuals are on the conference call line, could you please go ahead and just say your name? Okay, there was one individual earlier, but I don't hear the same background noise from when they were on. So if they rejoin the call and introduce themselves, I will let you know.
Okay. Thank you, David. Our second item is possible modifications in the agenda, and I would like to add a discussion of or revisiting of the possibility of reversing the amendment that was passed 2 sessions ago that altered the 1,500-hour requirement for clinical social work licensure by adding the words including but not limited to diagnosing and treating mental disorders, which would allow theoretically for someone to have a training plan that did not include the full 1,500 hours of diagnosis and treatment as all the other clinical independent licenses require. I had a discussion with Susan Ruiz, who is the state representative who put that amendment forward, and she was open to meeting with myself and David and Becky Fast from NESW and Andrea to discuss the possibility of rescinding that in light of the fact that it makes social work at a disadvantage because we would have clinically licensed social workers who don't have the same training as the clinically licensed other professions. So I will add that. I don't know where in the agenda we should do that, David.
I think we can add it to the beginning of the new business section.
New business, okay.
Yeah, I think that
All
would be
right. It's a revisit, but it's a new wrinkle, so we'll call it new business.
okay. And I apologize. On the agenda, you also have an item that's reflected as approval of the minutes from the previous meeting. I did get a draft back from one of my staff members on those minutes, but I'd like to work with them a little bit more on a few further changes to the minutes before you all review it and approve it. So it's okay with you. Let's just go ahead and table that item, and then we can go ahead and review the draft minutes at the next meeting.
Okay. That's fine. Let's move on to the executive director's report. David.
All right. Well, thank you, Cynthia.
Mhm.
Every meeting, I provide an update to the advisory committee as far as BSRB operations. And then I touch upon any kind of legislative updates and then touch upon some items from most recent board meetings. And so we'll start with BSRB operations. If you are familiar with the history of the BSRB, you know that we started back in 1980 when the body of social workers that was regulating that body and the body regulating psychologists, those were merged by the Kansas legislature. And then over time, as more professions have become licensed or registered, they've come under the jurisdiction of the BSRB. So now we are a composite board with 7 professions. And over time, we have done the best with limited resources as a state agency. We try to be very conservative in terms of how we're spending money, knowing that we operate not because the legislature does not fund the agency. We operate based on the license fees of the individuals that we regulate. And so one change that we are making, and I wanted to keep you updated on that, is we are switching our licensing host. And I think this is a necessary change. We have previously used older systems, but as we have continued to see a growth in the number of licensees and a call for us to be as efficient and move as quickly as possible with licensing, this is necessary. A number of other states and other committees have moved to online application processes. And while we have made some strides in the last few years to implement some good changes to our system, moving to this new Acela system under the state's enterprise licensing system will provide us even more advantages. And so this process is not a quick one. It does take about 2 years, and we are about probably 8 months into that process. Part of the reason why it takes so long is because they capture all of our existing processes, and then they take all of those and they basically change from a form-based system, which is what we have now, to a system based on answering a series of questions. So if someone's applying for licensure, let's say as a social worker, instead of basically them saying, I want to apply as a new applicant or through reciprocity or through another method, they will say, I'm interested in a social work license, and they'll answer a series of questions about their background, and that will point them into the direction in terms of what they qualify for. And this shall integrate other things a little bit more cleanly, such as the payment for different things. And so we're really excited about moving to this new system. As I mentioned, we're about 8 months into a 2-year process. And once we have it up and running, it'll be great for our applicants and licensees. And so I'll just keep you updated on that process. But I did want to let you know that we are spending time behind the scenes. Leslie and other staff members have done a tremendous amount of work making sure that the Office of Information Technology Services does understand our different levels and tiers of licensure. And so that is moving forward. I think we will be able to track information a little bit differently in the future too, once that new system is in place. So I just want to keep you updated as far as that goes. I do encourage you to continue to use CE Broker if you are coming upon the end of a license period and you're up for renewal. That is another resource the board has made available. We've added some new references to CE Broker and how to activate accounts for that. As a reminder, it is a free service provided by the company through an agreement with the BSRB. No one has to pay anything for it, and you're not required to use it, but we do encourage people to use it because we do think it's a nice service for our licensees. Moving next to some legislative updates. During the legislative session in the spring, the BSRB at times will have legislation relevant to the profession. Every year, we also go to both House and Senate budget committees, and we discuss the agency's budget. The legislature sets a limit for how much we can spend from our available funding sources. That is something that is part of the first few months of the calendar year. However, after that time period, the legislature does continue to have committees meet during the interim, which is where we are right now. And there have been a few committees that have really focused on health topics. So I want to make sure that you are all aware of one committee in particular that I think you would find interesting. And we are definitely monitoring information from this committee and looking to see if we can make any changes or upgrades or, weighing our existing processes. But there was a House Special Committee on Government Oversight, and it largely focused on the operations of the Kansas State Board of Nursing. Specifically, it was looking at what processes they use when someone has a license that is coming upon an expiration date. How do they get reminded about renewing their license? And do they get enough information about what it means if their license expires? And is it a violation of unprofessional conduct if their license expires? And then they even went into some of their disciplinary processes and investigative processes openly during the meeting. So they had a handful of people that had previously had agreed upon orders with the board, and there was some discussion upon individuals who had a disciplinary order that basically said that they had practiced after their license had expired and what that meant. And so the legislature was looking into those topics with the Board of Nursing. They did request some information from other health agencies, including the BSRB. I was asked to provide some information on our renewal and reinstatement processes, along with the Kansas Board of Healing Arts, the Board of Pharmacy, and there may have been another board too, but I think by comparison, the legislature was trying to learn more about this area, and they were critical of the Board of Nursing in certain areas, basically questioning whether they had really put out enough information about their disciplinary processes, whether they were being fair to licensees in terms of what was unprofessional conduct and what was not. And just as a reminder to all of you, it's not unprofessional conduct if someone's license expires. That's the main way that people retire when they stop practicing. They just let the license expire, and then if they want to practice in the future, they will need to get their license reinstated. The issue is when people are providing services under the scope of practice of a profession that requires licensure. Because if you're providing services and you're not licensed, that's unprofessional conduct. And if you were previously licensed and your license expired, but you didn't stop providing services, that's unprofessional conduct. And one of the main reasons for this is when people are providing services and they're seeking to get reimbursed for those services. Some of the insurance panels basically, I believe, have agreements where you basically agree that you will stay licensed while you are doing these reimbursements. And so if you are continuing to reimburse for services with them believing that you're licensed and you're not, it's essentially fraud. And so it's about protecting the public, and it's about making sure there are quality standards. But I think the legislature is also taking a look to see, at a time to where we need more practitioners in the field, are these things reasonable? And so I think it's never bad for people to ask questions, but I think in terms of the board reviewing the processes for the BSRB, I think our processes hold up really well. I think we give people repeated reminders when they have a license that's going to expire. We send them a letter when the license does expire to clearly say what that means. And then I think we're pretty helpful with people when they want to reinstate a license. We've put a lot of things into the law the last few years, including the 6-month temporary reinstatement license, the decrease of the cost to reinstate a license if someone has been out of the profession for over a year. And so I think we've been mindful of these facts, and we've been pretty proactive in this area. But I wanted to let you know about those meetings because we are monitoring them. We are listening, even if it doesn't directly affect our agency. We want to learn from that. And so if you're not familiar with the legislature's website, you can go to the Kansas Legislature's website, look up that special committee. It's a House Special Committee on Government Oversight, and they've met, I believe, 2 or 3 times now. Their meetings are broadcast on the Kansas Legislature's YouTube channel and archived, so you could go back and you could watch those meetings, or you could just take a look at some of the testimony posted on the legislature's website. So I try to keep you updated on those types of things, so feel free to take a look at those. If you have any questions as you're reviewing that information, feel free to reach out. And then turning last to some updates from recent board meetings. The board has met a couple times since your last advisory committee meeting. The board met back at the beginning of September and September 8th and held a general regular board meeting. One of the main topics the board is continuing to work through is the unprofessional conduct regulations. These are items that you personally, as an advisory committee, had the opportunity to review your unprofessional conduct regulations and provide feedback on recommended changes. And the other advisory committees for the board did as well. And now what the board is doing is we have put together a giant grid of similar items, and we're showing the language for each of the professions side by side. And the board is going item by item, discussing which language should be used across professions. Or is there a profession that is unique and needs to have different language? Also, is there an item that is, let's say, missing for one profession, but there is language for the other professions? And so the board is going through and making those decisions. When we get to the end of this recommended language, we'll ask the board to vote officially to approve these recommended changes. And then that language won't go into effect yet, but it'll go to the Department of Administration for technical review, and then it'll go to the Attorney General's office for their legal technical review as well. And if both of those groups have no objection to any of the new language, then we would submit that open for public comment for a 60-day time period. And I think the board would really benefit from a lot of individuals during that time providing public comment and reviewing that information. We're a little bit away from that based on the time frame of how the board is working through that information. But when we are ready for public comment, we'll let you know. And we also always publish a notice in the Secretary of State's website, the Kansas Register, when we get to that point. But if you have not followed the recent board meetings, that's one of the major undertakings of the board. And I'm really proud of the work the board is doing. There's a lot of really good, thoughtful conversation, and the board is making a lot of progress. Some of these regulations on unprofessional conduct have not been updated in several years, so it was time for a review, but syncing them up, I think, will be really helpful, especially for people that have multiple licenses under the board. The board also weighed in on using a company called eBOS. This is a company that helps out state licensing boards in Kansas and other states, providing additional disciplinary tools. If someone has committed a disciplinary violation under the BSRB, there are certain disciplinary remedies available to our complaint review committee, such as having someone undertake, let's say, supervision, or in some cases, even counseling. Maybe continuing education hours would be required for a person in a certain area. Maybe it would even be as severe as having their license suspended or revoked. But what this company, eBOS, would do, let's say that there was someone who had a violation in a specific area, like confidentiality. One of the available resources to the Complaint Review Committee could be to have them work with this company to learn more information about how to be a better practitioner in that area, and then verify that they have learned more information through a series of tests or writing a paper and having that graded by professionals who would work with the person to help them really understand what the issues were and how they can be more mindful and a better practitioner through this whole process. And so excited about that. I think the CRC is going to collect more information about the tools and the resources used by that company. And so that is another step forward in that area. And then just one more item from the board meeting that took place September 8th. There is certain language in the statutes and regulations where you notify a client if you're practicing under supervision. But there are other statutes that talk about someone practicing either under supervision or under direction. And so the board talked about wanting to open up that conversation if there should be some additional language clarifying certain sections that you also would have a responsibility to notify a client if you're practicing under direction, for example. So the board is going to continue that conversation at the next full board meeting, which will take place in November. And then moving to a unique board meeting. Once a year, the board likes to come together in person and have an all-day meeting. This was a meeting that is moved around the state to allow individuals in different areas to attend in person if they wish to do so. And so about 4 years ago, we had it in Kansas City, and then it was in Wichita. Last year, it was in Lawrence, and this year we had that in Manhattan. And that was on Monday, September 29th. And one of the main items we worked with the board on was providing some updates to BSRB operations and helped with a discussion about not just where the agency is currently, but where we want the agency to be in the future. And we would like to work with the board in terms of that long range planning. And so we had a staff member essentially present the concept of a strategic plan. And we discussed with the board, what that would entail if we wanted to put together a multi-year strategic plan for the agency. And the board was supportive of entering into that process. And so that will probably take some time to put that together. So over the next year, the board will be taking steps to do the SWOT analysis, if you've ever done that part of a strategic plan, and really work on a multi-year plan for the BSRB going forward. So really excited about that. We also reviewed items for possible legislation in 2026. You may recall back at the end of 2024, the board had a few different items that they were interested in putting forward in a bill for the 2025 legislature. But unfortunately, because of some technical deadlines and some issues with, receiving the draft back from the Office of the Revisers, and the unusual pace of the legislative session in 2025, we were not able to have the bill run this past session, but we are planning to have the bill run in 2026. And so really excited about that. So we did review the items the board had supported at the end of last year, and the board did express support for the same items with a few handful of adjustments. And so we're looking forward to going ahead and having that be introduced most likely in one of the health committees this year, and then kind of moving from there. So, and then let's see, the board also did a big review of the investigation policy for the agency as well. So I mentioned those special committee meetings from the legislature that focused on the operations of the Board of Nursing. One thing the BSRB did several years back, this was before my time, but I would say at least 10 to 15 years ago, that they came together and put forward a document that is the investigation policy for the agency. And this document had a cleanup about 5 years ago, but that has been posted under the policy documents for the BSRB on the website. And so that is something that outlines, the board. A lot of our discussions usually involve licensing, but also important to the public protection mission of the board. The board is in charge of investigating complaints against practitioners. And so individuals have a complaint filed against them. We investigate those. There's a group called the Complaint Review Committee. That document that's on the website outlines what cases would fall under the jurisdiction of the board, how those would be reviewed, the membership of the board members who sit on that complaint review committee. It outlines the process by which the investigations happen, the notification of the issues for individuals that have complaints filed against them. It also talks about the process of, integration of legal counsel assisting in that process. And then it talks about some of the orders that can come if there is a finding of a disciplinary violation. So I think it's a really good document. I think it's a little, I don't think every agency has a policy document like that cleanly walks through those steps. But what we did at that meeting is we had the board members walk through the different sections of that document, and the boards expressed support for continuing to keep that document on the website. And as we reviewed the policies with the lens that the legislature has been using on the Board of Nursing, I think the board was supportive of a lot of the policies and the steps that we are taking in that policy document. In addition, we informed the board about the frequently asked questions on the agency's website. So if people do have general questions about how the complaint process works, there are some additional FAQs on the website. And then also, I think one thing the Board of Nursing was criticized for a little bit, it sounded like maybe their investigators don't speak to members of the public, or at least the communication may be somewhat lacking. And talking with our investigators, while it is challenging because we do have full loads of cases for them to investigate, they do an amazing job in terms of customer service when people do call with questions. And they balance quite a bit on their plate. But I hear them in their conversations occasionally with members of the public or licensees, and I can tell you I'm really proud of the responses they give. We are limited in what we can provide. We don't give legal advice. We don't really go into hypotheticals with people, but we do want to make sure they understand the process. And so I think we do a good job in those areas, but that was something the board also reviewed at that out of town meeting. So I know there's a lot of items on the agenda today, so I'll go ahead and wrap up my report with that. But I'll be happy to answer any questions from any members of the committee if you have questions about the items I talked about or anything else.
I just would add that I think that the sort of timeline and step-by-step investigation policy that we have published is really important for transparency, because I think there have been complaints or they've cited that when you were telling us about the nursing board, about people not knowing, what happens if there's a complaint against me. Now, people could dig down into the uh, regs and all that to sort of piece that together. But for us to have it posted as a very clear step-by-step process, I think is really good service and good for practitioners to be able to see that clearly, as well as the public.
Yeah, and it's a little challenging, because the unprofessional conduct regulations outline a wide range of different items. So if someone were to ask, well, how long does an investigation take? I mean, it's kind of like if you were to think about it with, if you were to ask the police, how long does an investigation take? It's going to vary widely based on,
Mhm.
whatever the main issue is, how quickly can you get the information, whether there are other factors involved. For example, with some of our situations, if someone renews their license, we audit 10% of licensees when they renew. And if someone has an issue with their continuing education hours, that sort of an issue is not something that's going to take a long time to really get all the pieces in the investigation. Or if someone, did not renew by their deadline, but continued to practice, and then they realize that and they do a self-report to the board, that's the kind of situation to where, we're able to work with that person and get that information fairly quickly. However, if there's a more complicated allegation, like let's say that someone has a complaint filed against them that they were sleeping with their client, in that case, we want to reach out to the person who was practicing. They are going to need a sufficient amount of time to respond to that and maybe some additional questions. Sometimes they may say, I would like the ability to work with legal counsel in coordinating my response back to the board. And to ensure a fair process, we always allow the person to work with legal counsel if they want to. And so there can be some back and forth or request for some additional time. And so it's kind of hard to quantify, you know, how do you quantify one investigation? But as much as possible, we do try to be mindful of moving things through the process, while also making sure that, if we need some additional time to collect some additional information, this is all about protecting the public. And so, if it does need to take some additional time to make sure we're holding that responsibility, then we will do that.
Well, and also in the notice that goes out when your license is up for renewal, it is noted that you have to have your CEs completed before, and it's noted that even if you renew early, your 2 years start any CEs that you do between when you renew and when the end of your license period doesn't count for the next license period. So those kinds of regs that people could easily get tripped up on, where we make that's in the notice that goes out, and we get more than one notice about when your license is going to expire. So I think there's a lot of effort to make sure that our licensees don't get tripped up by some of those regs that they might not be aware of.
Yeah, and we've talked about it before. One last note, then I'll refer to you, Mike. I saw your hand was up. We have talked a little bit about the jurisprudence project that we are launching
Mhm.
this fall. We are still going forward with that. We've had some recent work in terms of looking at the technological side of that over the last couple of weeks. So I think we are moving closer to being able to launch that. But that is another area that we want to get some additional information out to licensees and applicants and students even. As much as possible, we want everybody on the same page. We want everybody, if things can go as smoothly as possible, that's the way that works best for everyone.
Mhm.
And so that'll be another opportunity for us to help people make sure they're firmly aware of the state level requirements. And then we can also provide some updates to them at the same time as well. So,
And for those of you that are new on the committee, I don't know if we've talked about that jurisprudence project recently, but it's going to be a voluntary online class or course that will cover all of these regulations that people will be able to go in and complete that, and that will be. I think there's going to be a CE available for it. Is that the plan? Yeah.
yeah, it would be a
So
1 hour voluntary webinar. We're doing a different one for each of the professions. And if individuals choose to attend it and participate, they'll get 1 hour of continuing education for free. So,
but it's not a requirement, but it also is good risk management for practitioners with their insurance companies as well to have completed it. So that'll be a great opportunity when that gets up and running. Okay, and Mike?
Yeah, my question was about the committee. You mentioned the Public and Health Services Committee, or the one that we requested the representative to reconsider the hours of. Okay. Now, I know that our legislative sessions are fairly short, in my opinion, and it's only several months long. The committees, do those committees function outside of the legislative time frame, or only during the legislative session?
They only meet during the legislative session, I believe. I think, when those legislators are not in session, they are, gathering information and perhaps meeting with
Okay,
constituents, et cetera. But the committee doesn't function except when the legislature's in session. And I will say that all three of our elected social workers in Kansas, and that's Heather Meyer, Susan Ruiz, and Susan Wilkie, are all
yeah.
on the Health and Human Services Committee.
It,
And I went to a fundraiser for them recently, and the discussion was that a lot of the legislators who want to get bills introduced will try to get it introduced in some other committee than the Health and Human Services Committee, because the social workers on that committee really hold their feet to the fire, ask a lot of important
good
questions,
questions,
and
yeah,
probably have been able to ward off, some of the worst
right,
impulses or some of the
yeah,
worst bills that might get introduced. But yeah, Mike, this last session, the legislature hit the floor running.
yeah,
And that was part of the reason why we didn't end up getting our bill introduced,
yeah,
because they were ramming through bill after bill after bill, with very little process,
right,
of discussion and
yeah,
comment, et cetera. So we do need to be ready. The bill that we introduced last year is now ready. It's drafted and ready to go. So I think, David, you said you thought we would definitely be able to get a hearing
right.
on it
Eh,
this year.
So my concern is we're work on a strategic plan, which is great, so we know where we're headed. But if the legislators can uh, go one way 1 year and kind of just ram things through, it makes it really hard on strategic planning, or the statutes and the regulations. So maybe it's like regulations could almost be more important, not more important, but um, some clarities or some
Mhm.
definitional things that help support the statutes that we can't necessarily, we can make recommendations, but it's a little frustrating to me. Like, I feel like I should almost just give my effort to, talking to legislators and saying, I think this is a good idea, and which is kind of backwards in my opinion, but um, Uh, I think the board and the committee system is a good way to try to provide information up into the laws or up to the statutes. That's why I asked the question about when do the committees meet? Are their assignments done January 1st so they know they're on that committee so they can work? Because they have such a short time to
Mhm.
kind of make things happen. That is the way it looks to me. I'm sorry.
Well,
But
I
thank
encourage
you.
any of us to talk, know who your rep is, and yes, try and talk with them about the trends that you're seeing and legislation that you would like to see, whether it's specifically related to BSRB issues or other issues. The regulation process doesn't go through the legislature. The board, proposes those regulations, and then there's a lengthy process that allows for public comment, et cetera, before those regulations actually get enacted. What does it take, David? Close to a year for that? Once we've decided to put forth a regulation, it takes almost a year before it actually becomes, the regulation. And so that works, that doesn't have to go through the legislature. So that is a way that we can, that the board, can have more impact on the actual implementation of the statutes. The legislators know very little about what our professions actually do. The main thing they know is we don't have enough practitioners. And so they're going to go for anything that they think is going to allow people to get licensed more easily, et cetera. But they don't really know. So educating your legislator about social work and all the BSRB professions would definitely be a good use of our time if you can get a meeting with them, especially in their off time from from and the strategic plan. The other thing, Mike, is that my understanding, David, correct me if I'm wrong, the strategic plan is about the board and what the board's goals are, not necessarily specific goals that we want to change this for this profession or that profession, but broader goals for the board itself, the functioning of the BSRB.
Yeah,
Each of the advisory committees, will have our own goals, about what we want to work on.
yeah, and I think that there's just a couple points in terms of the strategic plan for the agency. We are limited in some ways beyond what maybe, let's say, an association would be, or even private company. The legislature does approve how much money we can spend. We have legislative oversight of different things, but I think we can have conversations about values and priorities, and then try to focus things in certain areas. And then there are certain things that are required, and there's other things that we're trying to go above and beyond and offer as, value and services to licensees and applicants. For example, the jurisprudence project. Nobody's requiring us to go that route, but we saw it as an area of need, and we thought this would be helpful for us to go and kind of do that. But also part of it is to, how active do we want to be at a national level in terms of having our voice heard as a state? There have been a few things that honestly we've missed out on at a state level because our profile, was too small. Prior to my time here, when they were drafting some of these multi-state compacts, they didn't really invite us as a state to be part of that discussion, and we've tried to work with that existing language. And but part of this is trying to figure out, how can we have a meaningful role in some of these things, and how can we add value in different areas. And so knowing what limitations we do have, how can we do the best with our time and our resources. And in terms of what you had mentioned as far as the committees, just one little clarifying thing there. There are specific committees that do meet as just part of the legislative session. And those ones that are just legislative session committees, those tend to meet only during the session. And if you are an elected official for your 2 year, let's say on the House, you're elected for 2 years, you would be essentially a member of that committee for both years unless you were removed. So you would know that you were already going to be on. So if you were on health this past year, you're going to be on health again next year. But then every 2 years, everything sort of resets, and then they choose new House and leadership, and the Senate. Every 4 years they choose their leaders, and then that kind of helps determine who gets appointed to which committees and things like that. And there are some interim committees. There are things like the healthcare I think it has a very lengthy name, but it's the Can Care Oversight Committee, and it meets quarterly, I believe, for a couple different days. And that committee meets sort of during the legislative session, but also in the fall. And then there are some ones who get specific authorization to meet. So when I mentioned that House Special Committee on Government Oversight, I believe that was one that requested a few days to meet on different topics. And then it was approved by legislative leadership to hold those committee meetings. And they do that on a number of different topics. So you may have seen some things that talk about social services. There were some committees that looked at the IDD waiver and staffing for the new mental health hospital they're going to be starting up in Kansas. And they looked at contract nursing and some of those other topics relevant to health. And those are all really important topics. But I just kind of wanted to put a spotlight on one that was similar to what the BSRB is working on in terms of the size of the agency and our operations too. So.
And then the working together of this Senate and the House joint committees, or is there any of that kind of thing that?
Yeah, some of them are specific to one chamber. So you'll see some House committees, you'll see some Senate committees, and then you'll see some that are joint committees. And so, and also just kind of as a specific joint committee, there is a committee called the Joint Committee on Administrative Rules and Regulations. And Cynthia mentioned, the legislative role is a little different when it comes to regulations because statutes have to be in a bill, passed by the legislature. Regulations are not passed by the legislature. They do provide some oversight on regulations because anything we would put out there for public comment, we would need to go in front of the Joint Committee on Administrative Rules and Regulations, and they would ask us questions about any of the regulations or anything else. Not related to the regulations. And we would do our best to be mindful of their comments. And we would take their comments back to the board to say, the committee expressed concerns about some of these definitions or about some of these sections. And so we are trying to listen to the legislature too in that area, but it's a different process than when you're doing bill hearings and the language would need to be, passed as far as a statute. With the regulation, it's a different process.
Any other questions, comments? Thanks, Mike. That was good clarification, I think, for all of us. Okay, let's move ahead to the multi-state compact update.
Okay.
David is our commissioner from Kansas.
Yes, thank you, Cynthia. And I do get an opportunity. I was appointed to two different committees earlier this year. I serve as a member of the Rules Committee and also a member of the Finance Committee for the Compact Commission. And in that role, I attend those meetings and try to ask important questions, review information, and provide feedback back to the Compact Commission. One thing about the social work compact, I know everyone is very excited for us to start this compact. When we get in on the ground level, which is what we did for the social work compact, we were I believe, seventh state to pass the model language. And what the model language says is you need to have a minimum threshold of states to pass this before you can start the next phase, which is appointing commissioners. And then once you have commissioners appointed from the different states, you can start to get organization and get people together and figure out, what draft bylaws you might put in place to kind of put together sort of your framework for adopting things as an entity and electing leadership and different things like that. And so that has all happened earlier this year at some of the early meetings. We did meet, there was an elected leadership. These committees were established. Since that point, we have been working on some rules for the compact. We've also had some vendors submit proposals for a request for proposal to do a data system. That's maybe the one item that takes the longest when you're building these compacts from scratch. If you have a new compact, you need to figure out how are you going to have all this information secure and posted so that members of the public can verify who has a multi-state license and who doesn't. And so most of the way of processing these will be done on a state-by-state level, but you'll have those states all reporting to some entity, which is going to be through the Compact Commission, to relay all that information. And so to collect all of that, you need to have a data system built. And that data system is through a vendor, and this year that was another big undertaking in terms of the work of the commission. On the committees that I served on, we reviewed information. Some of that is confidential because proprietary, but essentially we looked at different vendors. And just recently, just about a month or so ago, there was a compact commission meeting, and when we engaged out of an executive session, there was a motion for the leadership of the Compact Commission to begin contract negotiations with one of the vendors to go ahead and build the working relationship for the data system. So since that point, I think the Executive Council has been working with that vendor to put items into a contract. And I haven't heard that that contract has been signed, but once that's signed, that'll give us an idea in terms of how much money will need to be generated for the Compact Commission for operations. I sit on the Finance Committee for the Compact Commission, like I mentioned, and there's a meeting this afternoon where we're going to take another step at looking at when you have the compact up and fully operational, how do you want to have that funded? Do you want to have it funded by some of the different associations, which is kind of who's putting forward some of the beginning money right now? There's a limited amount of money through federal grants. Sometimes it's helpful at the very beginning for support, but you really kind of need to decide, are you going to charge an administrative fee when you are issuing these compacts that will go back to the Compact Commission? And I think that's probably a likely scenario on this. So part of it is selecting the vendor, having the data system built, and then the other one will be looking at sort of how much money do you need for the operations? Do you want to hire an executive director for the Compact Commission? Do you want to hire any kind of clerical staff? How much travel are they going to be doing on a day-to-day basis? So are they going to have a physical office? Are they going to work remote from somewhere else? So a lot of these decisions need to be in place before you go out there and decide, to interview or post things and then hire someone for that role. But I think we're getting closer to that. So sometime in the next year, I think those decisions will be made. I think the system will be built, and then they will request some data from us to test the system, and then they will let us know when it's close to being fully operational. But just to kind of gauge expectations, I would say, based on what I've seen from the other compacts, I think we're probably about a year away from the compact being operational. If there's any kind of hiccups or something doesn't go according to plan, it could take a little bit longer. But I think for this one, I would guess that's probably my best estimate. It's probably about a year from now before we'll be able to launch the multi-state licenses for the compact. But like I said, I had that meeting later on today, hoping to gain some more information and provide some input on that. There usually is an annual meeting that will happen once a year. So the next time we do meet as a commission, I'll provide feedback from there's also a pretty good website for the Social Work Compact. And so if you do want to check out the website for the compact, there's updates posted there. If you ever want to sit in on a meeting, the Compact Commission meetings are open. Some individuals observe, some request to provide public comment on certain issues. So that is an opportunity too. If there's big items of note, we try to post news articles on our website, so you're aware of those things too. So we're just trying to share a little information about some of those things with you. So any questions on the compact? Hopefully that's helpful information in terms of the time frame. Just kind of my estimate based on what I've seen.
What do we have? Is it professional counselors and psychology are the two that are already up?
Mhm. Yeah. SIPAC is one where we were able to have our practitioners start utilizing that compact really early because it was already fully operational by the time we joined. So we were a little bit late joining that one. When SIPAC was put in place, it was put in place just for licensed psychologists, primarily to do telehealth into other compact states. And so that one is organized a bit differently. Professional counseling, it was passed a year before the social work compact. And that one has been through the process of being built, and it just started to launch just recently over the last couple weeks with 2 states. And then as more meet the requirements, they're going to fall under that. And so we are a member of 3 compacts for our professions, although they're not all fully operational yet. So.
Yeah. but sounds like it took a couple years roughly for the LPCs to get their commission up and running. So
Yeah.
that sounds like a realistic assessment that we've got another year to go.
Yeah, and I think kind of what I described as far as those technical steps, I've seen them walk through. So that's just if we follow a similar path, which I think we will, it'll probably be about that time frame.
Okay, great. Did you have a question, Mike?
We have statute approval to do this, or is this gonna
Yes.
have to then, okay, thanks.
Yeah, we were the seventh state to join the social work compact, so we got in very early. And in fact, the seventh state, the legislature did pass that law. Again, what they know is we have a shortage of practitioners, so they were more than happy to pass that for us. And this because we were this, it took 7 states before they could launch and start the process of building the whole commission, et cetera. So, yeah, we do have statutory approval to do it.
And I think one of the things that we're working on right now in preparation for the social work compact to be launched is that is one of the requirements. One of the requirements of the compact is for individuals to have a background check as a condition of licensure, and that is something that the BSRB has not required historically. So we do have authority to require a background check, and the board recently voted to make that a requirement, primarily, you know, to protect the public and also to come under compliance with these multi-state compacts. And so we're working on not just having that as a new requirement, and then we're working on trying to have it as an opt-in for people that are already licensed that would like the ability to practice under these compacts. And so it's challenging, but we're working through it. And I'm optimistic we'll be able to resolve some of those questions soon.
Okay. If no other questions or comments, we can move on to old business and our continued review and discussion of the survey that went out to social workers in Kansas. We've been looking at a few of those survey answers each meeting. So, David, you want to share your screen and show us what we're going to be looking at
Sure, and my
this
apologies
time?
on the agenda. I do have some topics listed. Um, as we talked about the survey and in our last meeting, we did collect quite a bit of information from a number of social workers. There were 2,000 social workers that responded to the survey. We provided essentially a first draft of all of that information to you for summary purposes. We have continued to review a lot of the information that was provided to. Over this weekend, I did a little bit more work to try to combine the sections that were not included in the original report. And unfortunately, that draft now, the version 2, is very lengthy, close to about 300 pages. So
Oh my goodness.
we were unable to send that out. And part of the reason is, the way that we organized this is we wanted to provide summary information at the beginning of the report about the first 20 or 25 pages, but we also wanted to allow the voice of individuals to be heard. So as much as possible, we included as appendices the open field answers from the individuals who responded to the survey. And I think if you have the time to really dig into that information, it really does help in terms of providing context to some answers, and you can start to see trends that way. But it is a lot of data. And so given the length of the report, we were going to have some difficulty sending it out to everyone. So I think we should have a version for you. We're either going to split it up or do something, but it's looking pretty good. But in terms of the last meeting, as a way to make this information a little more digestible, we asked you to focus on a few questions as you review the draft survey that you were provided last time. And so a few of the questions that we had asked you to go ahead and start to take a look at involve the question that talked about, have you identified or have you seen, based on your own experience or those in the field, any practice-related negative issues? Additionally, there was a question about over the past 2 years, have you seen any negative issues involving supervision? And then we also included a question on telehealth and a question on artificial intelligence. But I think for today, maybe we can just focus on the first two, the practice-related negative issues. And so what we asked people to do was take a look at the summary information in the report, and then also read the information in the appendices at the back of the report, and then come to this meeting prepared to kind of share your thoughts. Were there things that surprised you when you read through that information? Were there things that appeared to stick out as a trend? I know my staff members have worked on some of that summary information, so this is not necessarily about how best do we summarize it or quantify it. We have a general summary for you. It's really more about each of you on the advisory committee has an important role. You all have different backgrounds, you have different perspectives, and so it would be nice just to hear from you, given the different ways that you might be reviewing this information. What stood out to you, and it can be driven by your comments and your discussion. And we can look at some different questions for next time, but I'll go ahead and share my screen here. The question that dealt with any practice-related negative issues, I believe that was towards the back of the report. Yes, that begins on page 20. So I'll share my screen. Specifically, that question asked, it was for all three levels of licensees that we asked the survey question to. So this was for both the bachelor's and master's and clinical social workers. Said, over the past 2 years, based on your observations and experience practicing the social work profession, could you share information on any practice-related issues you have seen, such as areas where practitioners appear to need more continuing education or training in a certain area? And so in the report, you'll see a basic summary of some of the items that were highlighted by the respondents. You'll see how many people answered those questions. You do see some comments here from some of the LBSWs in terms of politics in the workplace, burnout, heavy caseloads, understaffing, the belief that the continuing education requirement is too high, or other financial burdens, there being a lack of resources, or pay in the profession is too low. And in terms of areas that more education was needed, most frequently reported area was ethics. So I'm happy we're moving forward on the jurisprudence topic. I think that should help address some of those concerns. But also on developing ethical guidelines for artificial intelligence and also telehealth. And I know the advisory committees have had conversations about both. Some of the other reported issues for the LBSW were interpersonal people or customer service skills, safety, boundaries, professionalism, trauma, cultural competence, child welfare, bias, appropriate supervision, compassion, or empathy. And then a few others that you see there as well. We need to go back and finish our review for the LMSWs. But for the clinical social workers, there's a description there in terms of any practice-related issues that were seen by the clinical respondents. Some of the areas that were noted were categorized as 4 main areas: ethical issues, documentation, insurance, and then areas needing more education and training. Some of those that were highlighted, including navigating boundaries with coworkers and supervisors, dual relationships in rural communities, professionalism, burnout, like you saw with the LBSWs, personal bias, quality of care to new graduates, social media, trauma care over telehealth, cultural competence, continuity of care, practicing outside of one's scope of practice, and then questions about HI or AI, political climate, LMSWs working in private practice, 2-year temporary licenses, and then a reduction of clinical hours.
David, is there a reason why they didn't put the number of responses on each of those in this summary like they did for the BSW?
I am guessing it probably just had to do with how many responses they were going through.
So would they be listed in order of like the most responses to the least, or were they just randomly listed as these are things that people brought up regardless of how many?
I would think they would be in order of how frequent that was noted, but I am unsure about that.
Okay,
They're not in another order I can just determine that because they're not in alphabetical order or something like that.
right.
I would think that there would probably be usually probably in order, but it could have just been categories that were listed.
Yeah, okay.
In terms of other areas, documentation, insurance issues that were highlighted, in terms of areas needing more education and training. Frequently reported areas included billing and coding, suicide prevention, business skills, clinical supervisor training, trauma-based care, addictions, autism, ADD or ADHD, telehealth diagnosis, documentation, DEI, domestic and sexual violence, eating disorders, and minorities. Other respondents highlighted communication issues between agencies, the lack of self-awareness among therapists, and an increase in burnout. So I wanted to highlight some of these. As I mentioned, this short version of the summary report is 175 pages because we did include the appendices for this question in the back, so you could read through all that information. But I'll stop sharing my screen here and see members of the advisory committee, if you could go ahead and unmute and then just share your thoughts on what stood out to you or struck you when you were going through this information, either when you were reviewing the summary information or when you were reviewing the open-ended responses.
One thing on the BSW that list that surprised me was unlicensed case managers. I guess if they're not titled as social workers, they don't have to be licensed. And so the social workers working under them don't have an avenue for complaint. I guess they just have to go through their agency, but the agency wouldn't necessarily have the same standards as licensure would require.
That's
Does
what
it-
we're running into now. We not only are case managers, don't have to be licensed. They just like a degree in a child, some kind of child field. And then we have support workers who work alongside them, and they've never had to be licensed. So, I mean, we can, take disciplinary action as far as work, but there's nothing we can do. And they don't have that context, that background, that education about a code of ethics, and it's just foreign to them.
Well, employers, well, I don't know, state agencies probably couldn't do that, but a private agency could require that even that unlicensed people follow a code of ethics, I think. But maybe maybe that would be seen as a barrier to, because I know it's hard to fill those positions anyway.
Well, and I mean, we have standards like that, but again, I mean, they lose their job, but that's it. It doesn't go across professions or anything.
So would a solution to that have to be some kind of more intensive training for people when they first come on board with agencies?
Oh, we try. So we're in 6 different states, and I'm like in Texas. They haven't had to be licensed in a long time. They go through like 3 months of training, same in Omaha because it's mandatory there. And they still feel like they're not prepared. So I think it's part of it. And not that any of us were for our first jobs, especially right out of school, but at least you had the context.
Right. Because you had been trained in a specific profession that had a specific code of
And
ethics and
simple things like engaging clients in conversations, having difficult conversations, just the impact of trauma and things like that. Like, no concept.
mm,
I wonder if, like, when they review the statute, the language, the legal stuff, if instead of saying real specific social work, it maybe defines it a little bit broader in the sense of support workers versus working in the social services field, something like that to help you or help agencies to be able to say, you need to be recognized by the BSRB and at some level. Anyway, that's just an idea
Well, your
on that.
support workers don't even have to have a bachelor's, right?
No. High school diploma.
So
And
the
so
only
then
thing,
pay wise and compensation wise is going to be part of the issue. Easy
Mhm.
entry, I think of like the addiction counselors, they went back to where they could have a person that came through the addiction process become licensed addiction counselors or something like that. But uh, there still was some, I don't know, I guess we had a lower level license at one time, didn't we?
We
For
still
social
have an AA, but we haven't licensed.
used it.
What are there, David? There's two of them still.
Yeah,
Last look, there was four
Uh,
associate level social workers.
Or, yeah, and
yeah,
we've talked about it on this committee a number of times about what would be an appropriate scope of practice for an associate social worker. And
right,
maybe a support worker would be one of those
right,
possibilities.
right.
But right now, it doesn't sound like any of those positions require licensure. They'd have to be called social work. But there's no question that the tasks are social work, but
Right.
they aren't listed as social work. I'm sure specifically so they don't have to be licensed
Right,
because that makes the pool of applicants much smaller.
right. That's why I said if we could maybe define social work as what it is. We see the job, we see the role, we see what they're doing. That's social work. It falls within the
I
law.
think
Anyway,
you'd
it just would protect the public and it would help agencies, it sounds like, because then
well,
you'd
but I
have
think it
someone to
might
fall
be
back
hard,
to.
it might hurt agencies because they'd have to then only hire licensed social workers.
Or they
I
have to
think we
get
have
that
to,
process going. I'm thinking of what Chrissy was saying, that she's sounded to me specifically frustrated at her role that she's in. But
Mhm.
Well, because I work in training, and so we're tasked with, getting all these people with no background on board and learning the details of their job. And I mean, we all thought it would be a great thing when we moved to they don't have to be licensed anymore, but it just created another set of problems
Mm.
that we did
and
not intend.
for me, the school psychologists are not psychologists in the sense of being licensed by the BSRB. They're licensed by, I don't know, something, by the school. And it just seems strange that they use that title, even though it says school psychologist, but yet they're not licensed by the psychology BSRB. So that just seems bizarre to me.
Yeah, they're licensed in Kansas under the Department of Education,
Mhm.
school psychologist.
Well, many years ago, you used to have a separate certification by the Department of Education to do school social work. They did away with that eventually, but you had to have so many hours, either in your master's program or after you took it after to get that certification. So they did away with that. You still have to be a licensed social worker, but you don't have to have that special certificate anymore.
Not a licensed social worker to be a school psychologist, to be a social worker
Social.
at a school, but a school psychologist is
Doesn't
licensed,
have to be a
right?
BSRB licensed
And so
psychologist, right?
they don't have to fall under the ethics, don't have to follow, you know. But I'm sure they have a lot of other rules that we currently don't have too. I don't know. I've not looked at their laws, but
Mhm.
it just seemed very bizarre to me. It's a little bit like being a caseworker and not being a social worker. It's
I
Mhm.
thought it was when I was at St. Francis, they changed the name from it was I don't remember. It changed so many
Community
times.
special.
Yes, and it
Yeah, we
changed to
went back to
that,
case manager now.
but they had licensed in front of it if you were licensed, but you didn't have to be licensed. It could just say permanency specialist. And that was frustrating because they don't have the same background knowledge and the understanding of all of the things that you go through to become a social worker. And there's just so much burnout and the caseloads are so high. The the demands are so high of child welfare, and so you have so much turnover, and then they're just like, we need a warm body to go to these visits that are court ordered with these kids, and so it's really a systematic issue. I don't know what the solution is, but it's very, I see it, it's still affecting me because I have kids in my school that have work, they're workers, but they're not trained and it doesn't feel like they're effectively doing the job.
Mhm.
And sometimes it feels like they don't even know some of the rules that are like the basic rules, like you have to see your kid once a month, for example. And so it just is, it still is frustrating me because I feel like it's not educated people doing the work, and the kids and their families are
Are
and
suffering.
the other professionals involved are like,
Yeah,
what are we going to do? But
Mhm.
there's nothing to do.
Yep.
right.
And these are the most vulnerable people.
And that's why I thought the burnout rate could go down if they had an ethical system they had to follow. If they had some guidance that said, hey, this is our scope of practice. This is where the lines are, the limits, and that could help the burnout because I think some of the burnout is they're getting pressure from the boss that, hey, you did this, therefore you're fired, you're out, and not necessarily wanting to be out. It's just that it
Sure.
looks like burnout, looks like turnover, but it's actually other kinds of issues. Anyway,
Well,
Well, it
years ago,
make
feels
it
like there, I mean, there's bad social workers, there's bad teachers, people that are not doing the right thing. But
even
that's
with the education, right?
exactly. But it feels like it's becoming more and more because they're opening the gates up to,
Mhm.
whoever, and that is really impacting a lot of people and causing a lot of stress within, the court systems, and just like it's a huge problem, I feel.
Well, and it's across the board,
Yeah.
it's not just social work or even just the mental health professions that we govern through the BSRB. It's, the legislature has been very, has been tossing around the idea of deregulation and sunset.
right,
Somebody actually
right,
tried to introduce a bill that would have sunsetted all licensure laws in the state of Kansas except doctors and nurses. Fortunately, it didn't get very far, but that sentiment has been there for years now in our Kansas legislature. They had a
right,
speaker a few years back that was, that was touting deregulation as the path.
right,
So, and some years ago when I was president of KNASW, we talked to DFS, and it's pay and it's training. Those are
Mhm.
the reasons for turnover and burnout, and they don't have the ability to absorb an entire social work education in 3 months worth of training or whatever,
Right.
and they don't, and also they're working, they're given a caseload and sent out to do the job. They need to
right.
Mhm.
be working
Instant,
alongside a seasoned social worker, for a period of time before they would be sent out to do that. And if we look at our complaint lists, we see that there's a very high number that go to the BSWs, and it's because they are being tasked with these very difficult decisions,
Mhm.
whether to take a child out of the home, et cetera. And these are very loaded decisions that are likely to draw those kind of complaints and concerns. So, in many ways, at the highest level, you maybe have we maybe have the largest number of potential unprofessional conduct opportunities, but it's our BSW level folks that may need more of that fencing that
Mhm.
that provides, and training to be able to stay within that fencing, and mentorship and all of that. And so I don't, That's money and time, and
Yeah.
that's where the
Right.
deficits are in the whole system, right?
And that's what I would argue for, let's say, a school psychologist even, that they should at least have an association with the BSRB somehow.
Well, I'm
Then
sure the Department of Education has their own unprofessional conduct rules for
okay,
school psychologists and other school personnel, I would think.
their education and their exposure is very different than what a psychologist has, in my opinion. But
Will they do
I don't
testing?
work in that.
They
Now,
mostly do testing in the schools. I was a school
right.
social worker for 5 years. They do, the school psychs do the testing. So they don't do, counseling, and they don't do a lot of what a psychologist licensed by us does. It's a kind of a narrow role in the school.
Right, and it's not psychometrics in the sense of all the psychometrics either. It's
Yeah,
certain
it's
kinds of
educational
areas,
testing. It's a narrow
but
window of that, or a
and also
portion of it.
behavioral, ADHD and ADD and those kinds of
Mhm.
things, which seems like it does fall under then the BSRB when you start to give diagnosing of these things. Eh,
Mm, I don't know if testing can support a diagnosis, but yeah, I don't
they,
think that automatically, and you don't actually have to be a psychologist to do that testing. That's just the
right,
way you can you can get certified or whatever to do some of that testing
okay.
without being a PhD psychologist.
Yeah, and
So,
I know we have time certain coming up too, and I know that's the trouble with these questions are big. And for me, it was the scope of practice under the licensed clinical
mhm,
social workers, what
mhm,
really triggers all of this
mhm.
conversation for me.
Yeah.
Now, someone else could say something, jump in.
I think as far as the training piece, all of the things that they were lacking, the training, the trauma, ethics, all of those things actually is big. I mean, those are important
Very
things
big.
when you talk about, serving clients in the communities. Those are things that you learn in school,
Hmm.
the graduate school. Now, we get a lot of um, students who do not have a bachelor's degree in social work in our graduate program. They have a bachelor in art,
Yeah,
but a lot of them have been working in the human service field. And so they
right.
come to the program thinking, well, I already know all this. And so I just need, get the piece of paper because I want to move to the next level.
Hmm.
And so we question them about, well, what is the next level? What does that look like? And then and they're surprised at the things, and they challenge, what our curriculum says. And some of them get this aha moment like, oh, now I get it,
That's what social work is.
Yeah, yeah. And that makes a difference. Um,
Huge.
yeah, yeah, it
So I
does.
wonder if one possibility, if there was some kind of, like you mentioned the addictions counselors earlier, and that they have a student license, and they created this because to try to, encourage people into the profession. And so it's available to anyone who has accumulated 60 credit hours, and is in a program to become a licensed addictions counselor. And it's good for 2 years, I think. Is that right, David? And
Yes,
I think it can be renewed once.
that's
In
right.
any event, it starts to build the identity of an addictions counselor. And so I wonder if in the agencies that are using people that are doing social work but aren't called social workers, if there was some incentive to take social work classes while they were taking that job, doing that job, if there was some tuition reimbursement or some partnership that could be built with the universities and the state agencies or the ones that have the contract, to provide some entry level social work courses, either at a reduced rate or at a reimbursed rate, that could begin to build the idea you're doing social work, and maybe helping create that identity and a desire to learn more and to go
Yeah.
forward in becoming really an official social worker.
And that's where I see the connecting to the BSRB. Just using that as a way to say it's going to fall under this licensing system. And that way,
But the people doing those jobs that are getting hired that don't have the background, they have to get a vision of themselves as becoming a social worker. That's not something the BSRB can do. We get them when they're ready to apply for licensure, but there needs to be, as far as the profession goes, a way to encourage those people to start to identify as social workers and realize that what they're doing is professional social work. And here's a framework and an education that will help you, be better at doing this job if this is what you want to
okay, the
do.
employer, so the agency that's hiring the whatever case, they're not going to have the incentive to do that. And it isn't going to be unless someone says, oh, these kinds of professions have to fall under this. You know what I
Well, they
mean?
may have the incentive to do that if they can partner with the schools. If there can be, and if somebody introduced a bill to allow for some reimbursement of course tuition for people who are doing those jobs now, who want to, become better trained and learn more about becoming social workers. But yeah, I mean, it's going to take money. I'm
They,
sure that if money wasn't a barrier, I'm sure those agencies would love to provide that to their workers that don't know what they're doing.
I agree, Cynthia. We try to go to these agencies and do presentations, not just to promote our program, but just kind of talk about, what it's like to be a social worker and what that looks like. Um, and we do try to partner, because we place our students in a lot of these agencies that are doing
Mhm.
some unethical and, having untrained, uh, I guess, supervision with
Mhm.
our students that has caused problems. But there are like ComCare. ComCare does have a state funding or wherever their funding is to send, their you have to qualify, of course, but to send their employees to get their MSW degree. We have a contract partnership with them, and they send them directly here. And what we discuss is they tell us what they a lot of it is diagnosing assessment and diagnosis, what they
Right.
see that they're lacking and they need more of. And so, we tend to focus on a course or even have a workshop included in the curriculum that focuses on that to help them. So there are
Mhm.
some agencies that do have money because ComCare pays for their entire degree, 2-year degree, books, everything.
And
And
that's
we
for
do
the
that to
masters.
we do it to an extent.
Or
I
you have
mean,
some tuition
probably not a
reimbursement,
full ride, but
but some tuition reimbursement.
Mhm.
That's great.
So that's
And
We
helpful.
we did some research a little while back in preparation for a grant that we didn't get, but but primarily about workforce development. And because I think a lot of the things that we're seeing in these lists, this burnout and overworked and high caseloads, and a lot of it, as some folks have noticed, is that we don't have enough people coming in who are qualified that we can choose from. And one of the biggest barriers we found in getting people into the profession is practicum and an unpaid practicum requirement.
Mm.
That if there's a way we could help people get the experience and do that while being paid, um, that would open up a lot of opportunities. But if we keep adding on requirements without helping people
Meet
access
them,
the
right.
education and then it kind of we get stuck in the middle.
Mhm.
And I know our agency would love to pay for those things, but we just can't. So somehow finding a sort of a way on a larger scale that can be paid for or taken care of in some way. But I think that's an important one.
Even
Or
we
if
just
do.
have
I
just have a supplement, even if it's not the
Hmm.
full tuition.
I was
Yes.
just
Um,
going to say that for my undergrad, I had like well, this is a long time ago, so $500 was a lot more back then than it is now. But I got $500 for my undergraduate practicum, which was, full time over the summer for 3 months, and
Mhm.
that made a huge difference. I
Yeah.
mean, my rent was
um,
$120 then, so.
and here at Newman, we did get a grant a $2.3 million grant. It's for workforce development for behavior health. And
Uh-huh.
so each student gets $25,000 for
Oh,
grad school.
wow.
Wow.
You have to be in your last year, whether you're part-time or full-time, and work in a rural or underserved area in behavior health, and you have to have all this additional training.
Uh-huh.
And so the majority of the money goes for that, for the
Yeah.
students.
Mhm.
Yeah. And we've had a lot of, our account is growing because of that.
Yeah. Yeah.
Yeah. So
Wow.
a lot of what these resources we were talking about are for people that are already in the profession and wanting to advance. But going back to the ones that are entering doing social work without being social workers,
Uh-huh.
that's where I think we've got many fewer resources to support them actually becoming professional social workers instead of doing social work without adequate
Yeah.
preparation.
Yeah.
Another thought that I've had is whether there could be some kind of a matching mentoring program for some of those folks that are in those entry level, whether there could, I don't know if that would be through the schools that they would have, cultivate a list of, I know Kansas City, Kansas Community College did this some years ago where they matched working social workers in the community with students to mentor them as they were going through their program. And so this would be more through the agency, some kind of a partnership between the agencies and I don't know who would be creating that list, but a school maybe that would sponsor that of having a list of people who are willing to be matched and
Mm-hmm.
some kind of structure to what that would look like, how frequent your contact should be, et cetera. But that might be another way to provide to extend how long these folks might last in those jobs and help steer them in the direction of if they like the work and they want to advance, become a social worker. Here's a path, here's a way that you
Right.
can
I
get
love
there.
that idea. And it is a lot to take on a student.
Oh, it's huge. Yeah.
And it sometimes feels like I love giving back to the profession and I love molding the young kids. Um, but it's a lot. And when you're working full time and you have a part-time job and you have a family, it's sometimes so much to take on. And it doesn't always feel like you get all that you
Mhm.
need from, and I know that's maybe not the right, but it does feel like that sometimes, and sometimes I'm able to do it, sometimes I'm not able to do it, but
No, that is the
I don't
right
know if
thing because self-care is one of the things we have to
Yeah.
always teach
Right.
anybody who wants to be a social worker. So
sure,
you have to
yes,
meter what you can
I
provide.
did that.
Yeah.
I had a master's level one reach out, and I've almost every year had one. um and I also wish that there was some kind of, I don't know what it is, I don't know, but like to make sure that who you're paired with as your supervisor, I can't think of what it's called, is a good worker themselves, because I felt like my bachelor's level person, social worker that I was following, she did some unethical things, and I kind of took it as, okay, this is a non-lesson, a lesson of what not to do. And I use that still, like, but if there was some kind of, I don't know, like these are like the good workers that we want you to be following and learning from, rather than just, okay, she's been a social worker for however many years, we're going to put you with her. Because you don't have to be seasoned to be a good worker. You could just be a couple years into the profession and still be a good worker. So I don't know if there's with agencies some kind of like vetting
Vetting.
process
Mhm.
that you could
Yeah.
be like pairing your students with people who you want them to learn from and be the good models, because
And
I
that
experienced that.
goes,
And actually when I was at St. Francis, there was only one licensed worker there, and so that was who you got with no matter what. And there, all the others were just permanency specialists, they weren't necessarily social workers. And so you didn't get a choice if it was, even if it was a good worker, but they, because they weren't licensed social worker, you couldn't be underneath them learning from them.
Right.
I
Really,
got paired
that's
with,
why I'm thinking if we had some way to get this kind of segment
yeah,
into the social work feel,
Mhm.
and that could be what legislators are feeling in terms of need of more social workers, or it could be that entry level track, and they could get over there to Newman and get connected into a program or whichever school is nearby. It just seems like there should be some way to do this, and
Well,
then
and
we
that
could
it
You're
really
might
right.
help
be,
these students.
And there's I'm thinking of, I
Or
work in education, so there's a transition to teach degree. I don't know
right,
if there could be, I mean, from my understanding, you're teaching while going to school. If there could be something where you're social working while
while you're
still
getting
going to
your
school.
degree.
Yeah,
Well, that would be
um,
like the student license that the addiction counselors have.
exactly. Something,
So
I mean,
that,
yeah,
but that license does require that they have completed 60 hours.
sure.
So, it wouldn't be for somebody that didn't have any
Right. And
education,
my
but
understanding
it
that
might get them
transition to
started.
teach is like they have a different degree, but then they realize after they've graduated, oh, I want to be a teacher. So they have
Mhm.
that 4 year knowledge, and
Right.
I don't know if it is specific what all they have to be, but then they can go and have fast track
They
to
have to take
get
their
all the
education
teachers.
coursework,
Right.
basically,
Exactly.
and then they can, yeah, that whole plan was created because of a shortage of teachers.
Right.
So we've got the same
now
problem.
I
Yes.
And
haven't looked at any other state. Maybe other states have solved this, or maybe the NASW might have some ideas. I don't
I
know.
doubt you would find a single state that says they have enough social workers to cover, cover the
And that
need.
they have some kind of licensing path, or that they have
Mhm.
a 60-hour, to become a permanency counselor, or to be I don't know,
Those would be maybe certificate programs,
or
right?
certificate, something, so that,
Well, the schools that might have some kind of programming available, it would be good for them to be able to come to the agencies and talk with those lower level workers about about a program that they could offer. And, that would be enough. I know David and Leslie go around to the schools to teach the students about licensure and about the path to licensure, which is huge. I mean, that
Hmm.
did never happened in the past.
I love
Students
that.
yeah, the students were kind of on their own to figure that out, and had quite varying abilities to do so. But if schools that could offer that kind of a program would go and recruit and talk to the people who are doing social work in an agency without the title, without the education, and say, here's what you're doing is social work. So here's a path for you to advance your education and become better qualified to do what you're already doing and have a path to advance, to a higher level in your agency. And that again, that plants that vision of I am a social worker, I'm becoming a social worker. That's my profession. And I need to embrace these ethics and I need to
Mhm.
function like a professional social worker. You have to
Yeah,
plant
this
those
this
seeds.
is a great discussion. I know we're getting close on time. We only have about
Yeah.
15
yeah.
minutes left.
Oh,
So we'll probably have to table a few of the topics on the
sure.
agenda, but I did want to just mention as far as a plan for going through this discussion and talking about these different things, I want to make sure that we have a good plan for how we're going to use this information. And I think one thing what I would say is as we go through these different topics, go ahead and put stars in your draft report or make some notes that we can come back to as we go
Mhm.
through these questions. Because I think at the end, what we'll probably do is we'll ask each of the advisory committees, after reviewing the survey results from all the professionals, all the licensees in your profession, do you have any recommendations on things or any dialogue you want to provide back to the board that you think would be helpful as the board considers priorities and looks? And, some of these things we've talked about maybe under the jurisdiction of the board. Some of these may be outside of what we can control or how, in terms of what our responsibility is too. but if there are items of note, I think that's helpful too, because we could build new relationships and have conversations with new partners that maybe we can't do something with this information, but we could pass it along, and then other individuals or groups could pick that up and go from there. So I
Well, and
want
several of you are all in education, so you're already have these ideas that you could pursue with your organizations.
Yeah, I think this is great, and this conversation is really helpful. And it's I appreciate you all kind of jumping in and sharing your thoughts and your feedback, because this is great. This is exactly what the advisory committees are
Mhm.
helpful for. So in preparation for the next meeting, how about looking at those two items that were on the agenda for today, after that question on negative
Mhm.
practice related issues or areas where people needed more education, look at the question involving supervision. The summary of that one begins on page 27. And then go ahead and focus on that question involving the use of artificial intelligence. That question begins on page 29 in the draft report as far as the summary. But we've had a topic on the agenda this year that
Mhm.
was regulation of artificial intelligence, and I didn't want it to come off the agenda until you had the opportunity to really review the survey information on
Mhm.
AI from all of the licensees. So now, whether you want to keep it on as a placeholder to keep that as a discussion topic, that's totally fine too. But I wanted to make sure that we covered that question before you
Yeah.
had a chance to forward recommendations back.
And yeah, because we are almost out of time, I do want to get the committee's um, uh, opinion about pursuing the possibility of reversing the including but not limited to language for clinical social work. We decided, if you recall, not to include that in the bill that we presented last year, which we didn't end up getting to present anyway because of how quickly the legislature went and difficulty getting it drafted in time. But so we will be presenting that bill in January when the new legislature starts. And the reason that we decided not to include it in the bill last year, though, was because we were concerned about opening up the statute. Anytime we open it up, then bad stuff can happen, which is exactly how we got that amendment in the first place, was it got tacked on to our bill as another, amendment, and I think sold as a way to increase the number of social workers. But as we've been talking about, increasing the workforce shouldn't mean lowering the quality of preparation and abilities and skills below a level that is safe and competent. And just from a social work and with the other professions that, we far and away have the most licensees in Kansas. But there are, several other clinical level licenses, and we've standardized those requirements across those professions. They all have to do 3,000 hours. They all have to do 1,500 face-to-face, including telehealth, diagnosis and treatment. So if we allow this to stand, it makes social work less than. It means that our standard is less than any of the other clinical licenses. And the really ironic thing is that those other licenses came in after social work, and they all had to rise to our level. We were the standard. And so if we allow this to stand, it's reversing after we really required those other, professions to meet the same standard. It would be, turning that around. So, but the question is, do we have that same concern at a level that we don't think it's safe to include that? I I think I'm trying to remember if we had other social work recs in that bill.
Well, and Cynthia, how about if I go ahead and show the language you're talking about? So I
Okay.
pulled up a couple of example statutes, one for clinical professional counselor applicants,
Hmm.
which is how the language previously was worded for each of the professions. And
Right.
I can kind of show the social work language with that change to show
Hmm.
how it's not consistent with the other language on clinical applicants. Um, I'll share my screen here. Um, And just for reference, this is KAR 6 or KSA 65-5804A. So as I said, this is KSA 65-5804A, and this is really a number of different sections as it relates to applicants for clinical professional counselor. The question, the language in particular that Cynthia has referenced, there was a requirement for all the clinical applicants that they complete not less than 2 years of postgraduate supervised professional experience in accordance with the clinical supervision training plan approved by the board of not less than 3,000 hours of supervised professional experience, including at least 1,500 hours of direct client contact, including psychotherapy and assessments with individuals, couples, etc., and not less than 100 hours of face-to-face clinical supervision. So that is the language that was consistent for the applicants for clinical licensure across the professions. Now I'll show you a copy of KSA 65-6306, and this is the language that was changed. And so by comparison, instead of saying 3,000 hours in not less than 2 years with 1,500 hours of direct client contact, providing psychotherapy and assessment, what this language basically says is not less than 2 years of postgraduate supervised professional experience, not less than 3,000 hours of supervised professional experience, including 1,500 hours of direct client contact. And then the critical language is this: including but not limited to conducting psychotherapy and assessment with individuals. And then it goes on from there. But the including but not limited to means, at least through what we understand the interpretation to be, that instead of you getting 1,500 hours of conducting psychotherapy and assessments, it just means within that 1,500 hours, it needs to include psychotherapy and assessments. But to what level?
Not specified.
It's not
So
specified.
theoretically, it could be, you could have 1 hour of psychotherapy and then the rest of it could be some other type of social work. And that you'd have to count that as adequate for a clinical license, which it clearly is not. So,
But we're still using the same testing, right? They would still have to pass the same test.
yes, yeah. They would have to pass the clinical exam. That's still in there.
The
That's
test
very-
is kind of simple, but
It's
when you're
concerning.
doing the dialogue with your supervisor and all the stuff that goes on in that supervision about the diagnosis, about treatment plans. I mean, it's what you do during that
Well,
time.
I mean, to me, the basic standard is same privileges should equal same preparation. If you have, and the problem is that the argument that was made when this was put forth was, well, there's lots of social workers who, want to get that LSCSW because it's the highest level of licensure and they'll get paid more by their agency and blah, blah, blah. And a lot of LSCSWs don't end up doing clinical work. Well, that's all true, but they're licensed to do it. So somebody who has an LSCSW who might not have had the clinical preparation that we have required up to this point could theoretically go hang out their shingle and start treating clients, even with minimal actual clinical preparation. So this is why I have felt so strongly about trying to reverse that. But my question to you all is, do you feel like this is important enough to go ahead and risk opening up the statute by including that in our bill for this year?
I have a point of order
Yeah,
on the meeting. We only have a couple of minutes and I have to really leave in just about a
okay.
minute. Do you need us to make a motion to authorize this? Because I would say that I would move that we include the wording as you guys have worked with the legislator to kind of clean up that element.
Well, we haven't, I talked with her at a meeting and
Oh,
or at the fundraiser, and
that's right.
she agreed to have, or she suggested she was open to having a meeting to talk about changing it. So basically, we would be removing that one phrase, including but not limited to. So it would revert to what it has been for many years, and
Well, I
that it would be
move
the
that
same
we
as,
do that.
okay,
So,
all
I
right.
think that's pretty important. Yeah.
Because you could, they could still technically be doing lower level social work stuff, not that clinical work,
Mhm.
and be counting it as their hours.
Right, exactly. Yeah.
I think it's
As
That's
hard enough to
concerning
get quality.
because I
yeah,
know
Yeah.
it, that's
yeah.
concerning to me. I
yeah.
don't,
We already have difficulty getting qualified folks who are
right,
licensed at the clinical level. I don't think we need to make that
muddy it up.
Yeah.
Or make their requirements less, yeah, clinical. There's one, okay, I Mike made a motion. I guess we've had discussion. Is there a second?
I'll second it.
Okay, and all in favor of including that in this bill, if I can get Susan to back that? Yes.
Aye.
Susan Ruiz, who's the social worker, by the way, who introduced that. And then there's one other thing that Leslie had brought to my attention, that apparently none of the other clinical licenses require references because they've already been provided when you get your master's. Although the other ones, do they require that they be licensed at the master's level while they're doing their clinical training?
Yes.
Yes. Okay.
So
So
it
we
would
all
be
have
like
to,
LPC, the LCPC.
okay. So we all have to have a master's level license to be able to start our clinical training for the clinical license. And we have to provide references at that point. Plus, if they have had a BSW license, they would have had to provide references then too. And when someone applies for their clinical license at the end of their training, they have to provide, the attestation from the supervisor. And do we need references then at the licensure point,
I think it's just
Well,
attestation.
currently,
Leslie?
the LSCSW application requires references. And so I was wondering if you should be in line, because it seems,
With the other
fair
one?
that, yeah, that the regulation would say if not previously provided to the board. So if they weren't an LMSW, they would have to provide all the references. But if they are an LMSW, they would only have to provide the application and the supervisor attestation form, which includes a lot of information that the reference does too. It's just from the supervisor.
So it would be eliminating one piece of the LSCSW application, that they would still have their attestation, they would still have to provide their logs, et cetera, but they would not have to provide additional references if they've been a LMSW in Kansas and already provided references when they applied for that license. And you're saying, Leslie, this is consistent with all the other clinical license applications?
Yes,
They
it
do
is.
not have to provide.
I'm just
Yeah,
thinking, what if they were not, I mean, say their supervisor thought they were, but others that would potentially give their reference did not feel that they were at the clinical level yet. I don't know what that
fit
would,
to be licensed, right?
Well, I mean, I would hope that the supervisor would have more insight than coworkers. And I will add that the other professions, when they do provide references, they don't have to be from that profession. So they could, LCPC could provide an LSCSW reference. Social work specifically says they have to be LSCSWs, which when they're out in the field in private practice or in other agency settings, some of them don't have a lot of contact with other LSCSWs that can speak to their work. So, and I can say that unless there was a work problem, but didn't really play into their clinical skills, but maybe their relationship with others, I don't think we've had any references that provided that much negative information that it made a difference in the application. It's usually the supervisor that,
Yeah,
that brings up the concerns.
I'm thinking about the apps that we have to consider at our CAPA meetings, and when there's any kind of a problem with an application. And we do look at those references when you send us a file but the most people are going to know that their person they asked to give them a reference is going to recommend them for, and I'm trying to think about the ones where they haven't recommended them for licensure, and I think that's been the clinical supervisor. Andrea, what do
Yeah,
you
I would
think?
agree with what you and Leslie are saying.
And also to keep in mind, just for your comfort, if the supervisor had issues and they brought them up, that we could still ask for permission to go get information from their employer or their work supervisor or something like that, if there were any,
Concerns.
concerns brought up.
So the one issue would be if for some reason the clinical supervisor thinks it's fine and one of their coworkers has an issue.
Mhm.
And, I mean, we could fall back on the fact that as licensed social workers, one of our obligations is that if we have a colleague that has a problem, that is not practicing ethically or et cetera, it's our obligation, our responsibility to report it. So if somebody's applying for clinical licensure, their clinical supervisor recommends them for licensure, but a coworker thinks they're not fit, it would be incumbent on that coworker to make a report or whatever about that. I mean, it's a small thing in the packet, but it can be a big thing if they don't have a lot of clinical social workers
I
around
understand.
them. It can be a barrier for them to getting their packet complete so that they can get
And
their
stresses them out a lot when they're trying to get
Say
their
again, Leslie?
application. Then it causes stress to the person applying when they're trying to get this all together, and yeah.
And again, if they were not an LMSW licensed in Kansas, then they would have to provide those references when they apply for their LSCSW. This is
Yes.
only eliminating that from already licensed LMSWs applying for their LSCSW, right?
Mhm.
So do we need to take a
So
vote on that one?
I think because we were right at time, a couple members of the committee had to log off. So
Oh, do we not have a
we are
quorum?
one less than quorum, so we'll just need to carry this forward and
Oh, okay, all right.
ask the committee for action on it at the next meeting.
Okay, all right. Yep, sorry, didn't realize we just ran over. Well, thank you so much for staying 5 minutes extra. That was a very good discussion, and hopefully we can continue that at our next meeting. Thank you for being on the committee. Your views and knowledge is really important to the work that we're doing. See
Agreed.
you
Thank
all
you.
next time.
Thanks, everyone.
Bye-bye.
Happy Halloween.